Hey there, everybody. Thank you so much for joining. We are going to go ahead and get started in a few minutes. I know this topic is really important to everyone, understanding what to do in the midst of COVID-19 and the CNA schools and the issues that are going on with the CNA schools as well as the nursing homes. So before we get into it, I'm going to introduce myself as well as, and then Vicky, I'll let her introduce herself and we'll get into it. Please feel free to ask questions throughout. You can leave comments in the comment section. We'll definitely look at them and answer them as we go. But my name is Victoria Randle, and I am the owner of The Secret Cocktail, and we help to start CNA schools in all 50 states. I am a family nurse practitioner and have been in the medical field 15 years plus. Vicky, you want to introduce yourself?
Hi, everyone. Good to be with you. I'm Vicky Castillo. I am an RN, and I am the founder and CEO of Facets Healthcare Training, a CNA test prep. And I am joining you from Phoenix, Arizona, where I am also a CNA instructor and here in Arizona, and lots going on here with the coronavirus issue. I was on 3 conference calls on Thursday and another one yesterday, so a lot going on. And so we hope that the information we're going to share with you, although general information, hope will be helpful to you all. And hopefully with all of us brainstorming, we can come up with some strategies that will help us move forward with our CNA community and how we can move forward with what we need to do, particularly the clinicals. That's the hot topic.
That is the hot topic. So no worries. We're definitely going to get to that. Before we kind of get into all of that, though, I do want to give an update. Now, the information I've kind of heard already since we first put this together has changed. I know in the state of Georgia overnight, the cases of positive COVID-19 have actually doubled. So, and that's just in Georgia. So I know that some of this information may not be as up to date, but we're trying to make sure that it is as up to date as possible. So the first thing I just want to talk about a little bit is just basically the virus update. So the CDC's website, which I know you guys are well aware, that's probably the best place you can get any information regarding this topic, the CDC's website as well as WHO. But the CDC is updating their website Monday through Friday at 4 p.m. every day. So I'm not quite sure if they're going to give us updates over the weekend, but per their website, that's when they're doing updates. The WHO, again, they're monitoring it on a global level. So globally right now, there are over 132,000 confirmed cases of COVID-19 with well over 5,000 deaths currently. And that was as of yesterday at 10 a.m., March 13th at 10 a.m. So when we look at the United States only, though, because that was at a global level, but when we're looking at the United States, in the United States, there has been near 2,000 cases and 36 deaths so far. But again, that was as of yesterday morning. So when we're kind of looking at that, I think that this is a scary topic for everyone because of the ratio of actual confirmed COVID-19 cases versus the actual deaths. So currently in the US, when we look at it like that, 1 out of every 35 people who get COVID-19 have passed so far. So, I mean, that could be scary, but we're going to talk about that a little more as well. I think the biggest topic right now and what's hitting CNA schools right now is because of what happened out in Washington. So for those of you who don't know, earlier in the week out in Washington, a nursing home called Life Care Center, just northeast of Seattle, actually had 67 of their 180 employees that actually had COVID-19 symptoms. The residents dwindled from 120 residents all the way down to 47 residents. Okay. So that was scary for that facility, I'm sure. Dozens of people ended up actually hospitalized, and more than half of the current residents have tested positive in that facility for the coronavirus. So also, at least 22 people in that facility or associated with that facility have died in the past 3 weeks. So the idea surrounding nursing homes, and we know that our elderly people are a really, really high risk population. The more elderly and comorbidities a person has, the more likely they are to pass away from this virus. So that's why this is a center of attention right now. So I'm going to turn it over to Vicky. Vicky, if you can talk a little bit more about what that looks like for the CNA schools.
Okay. So what's happening because of the coronavirus, and also especially yesterday with the state of emergency that was brought forth by the visits to nursing homes nationwide will be temporarily restricted under the national emergency that President Trump declared Friday to battle the coronavirus. So with that being said, most of the CNA programs, that is the majority of facilities that they use for their clinicals. And so now that that restriction is in place, it's not likely that CNA schools will be allowed to complete their clinicals there. So that creates a major concern or a major obstacle for CNA schools saying, well, what are my options for clinical sites? So I wanted to start out by saying that that the information that I'm presenting is general information, because every state is specific in terms of the number of clinical hours that they are required to do and where they can do clinicals at. So this is general information. So every state is different. So for yesterday, the national emergency that President Trump declared on nursing homes restricts all visitation except for end-of-life issues. It restricts all volunteers and non-essential healthcare personnel. Students are essential in my opinion, but it's questionable whether that's included in there, probably though. And non-essential personnel would be something like hairdressers and what would be another example?
You know, activities direct, you know, the people who come in and do different activities with them, the volunteers, the candy stripers, as they used to call them, things like that.
Right, probably activity directors, medical records people maybe as well. So they cancel all group activities and communal dining. So people are probably going to have to eat in their rooms. No more activities as well. They're implementing active screening of residents and healthcare providers for fever and respiratory symptoms. And then, so that's what's in place right now. So,
real quick, I want to say thank you, ladies, so much for joining. I want to let you guys know that I do see your comments. I will address them. If everyone can just tell us what state you're in and what you have encountered so far, that'd be great.
Yeah, I'm going to pause there and see some of those comments here.
Yeah. Definitely what happened in Seattle and Washington is a scare to everyone else. And that's why we know this is a vulnerable population. I think that we have to identify different ways that we can still get this education to CNAs, because if we put a hold, and this is not just CNAs, guys, Vicky, you said it. I mean, we're looking at all types of medical professionals, nursing, CNAs, these are all students coming into these different types of facilities. So
that's right.
Who are being affected.
Exactly. We think, we feel it the most because of course that's the industry that's the area that we're in. But keep in mind, this is also a restriction on nursing students. I'm sure LPN students, but of course LPNs are nurses. No, I didn't mean any offense by that. But RN students, LPN students, physical therapy students, occupational therapy students, so, and speech language pathology students. So any students that are involved in healthcare, which is a whole slew of them, are affected by this. So just keep in mind that it's not just CNA, although because we're in that area, we're feeling it the most. So we're in it with other students as well.
Yeah. Okay. So Vicky, we've definitely come up with some ideas for you guys. You know, we highly encourage you to be in constant contact with your Board of Nursing and or the Department of Health to talk to them about different ideas and different directions to go. But I'll let Vicky take over because she's come up with some really great ideas or tactics that you could possibly implement.
Okay. So one of the concerns that I have, it's kind of a double-edged sword. Yes, they're restricting students from going into the clinical sites, particularly the long-term care facilities in this case. But that will only, in my opinion, add to the shortage of frontline healthcare providers, in this case CNAs, because there's already a critical shortage. And then with students not able to complete their training, if the pandemic worsens, then there's going to be less nursing assistants to be able to care for the sick. So it's just like almost a chicken and an egg situation. So I think that I'm hoping that some contingencies are made, concessions are going to be made to allowing students in there. Also, we don't want to put the students at risk either. We want to keep in mind that we don't want to put the students at risk. And even though generally students are not in that high risk population, should they transmit the disease and take it home or take it out to the community, that's a concern as well. So I understand the state of emergency. So it's just a multifaceted situation going on there. So let's see here. I'm just gonna.
I know. So Sade says out in California, no visitors or patients are allowed, that nursing students and medical students are allowed to still do their clinicals, but the CNAs are not. And I think that's a state by state case, because I've definitely heard in some states already where they're not allowing nursing students to do their clinicals in long-term care. Now we do have to think about most nursing students and doctors do theirs in hospital settings, but right now the state of emergency has directed specifically to nursing homes. And we know why, because of A, what happened in Washington, and B, because of the vulnerability of that population. So
Victoria, I want to pause here for a minute. Apparently we have a wait list on our feed and people are not able to get in. So I'm going to address that. If you can go ahead and move forward.
Yeah, no problem.
Okay, let me address this here.
Mm-hmm. So we'll come back to clinical alternatives, okay, guys? Because I think that's a really important one that you guys I know you want to hear about, but I'm going to let Vicky deal with that. And I'm going to talk to you guys about, this is an opportunity of what we need to identify that we need to be implementing in our curriculums that we may not already be doing already. We know that PPE application and spreading of organisms and things like that is currently inside of our curriculum. But how many of you have taught about N95 masks? Let's just be honest. How many? Because it's not in many of the books. So how many of you have actually taught about N95 masks, about PAPRs, and about droplet precautions in particular? I know that a lot of the books don't really touch on that specifically. So I think that this is an opportunity for us to make sure that we're talking to our students about this and explaining to them the seriousness of this and why a regular surgical mask isn't necessarily going to work in these situations and why. So this is from the CDC's website so far about what they know about COVID-19. A lot of the information is still forthcoming, and we're depending on China for a lot of information right now because we don't really know. It's just now hitting us, and we're just now doing our own experiments. But it's thought that this particular COVID-19 is droplet. So, often it's spread from living persons within close contact, usually within about 6 feet via some type of respiratory droplet that may be produced by an infected person when they cough or when they sneeze, similar to like influenza or any other type of respiratory pathogen, right? So this is an opportunity for us to incorporate in our curriculums to teach students to make sure that they are gowning, that they're gloving, and that we introduce the concept of an N95, NIOSH certified N95, right? And that they understand that you have to be fitted for N95. You can't just take any N95 and put it on and think that it's going to work appropriately for you. You have to be fitted for it. And that if you can't, for whatever reason, be fitted for an N95 mask, that you then may have to be fitted and taught how to use a PAPR. Now, I know a lot about this because I did occupational health for the past 2 years before I started this business, the Secret Cocktail. So this is like in the forefront of my brain. I realize a lot of people don't even understand or know what a PAPR is. Please be honest. Do you know what a PAPR is? Anybody in here know what a PAPR is? A PAPR is a device that is utilized for individuals that cannot be fitted for an N95 mask. Maybe their face. Usually it's people who have the broader chins that can't maybe fit into an N95, or maybe if they're a little heavy on the heavier side and they can't get the large to get a snug fit, then they may have to be fitted for a PAPR. So the PAPR is literally, it kind of looks like one of those hazmat suits. It's a big, giant, space-looking device that goes over the head, and it has an attachment to it. So the attachment to it is a little, kind of like a little device that as soon as you push the button on, it has this very loud sucking sound like a vacuum cleaner, and it provides positive pressure. So this device helps ensure that no air or any type of air with potential secretions can make it into the mask. It's constantly pushing positive pressure to keep all that type of air and possibly contaminated air out of that person's breathing vicinity. So the PAPR. So they have the N95, but then they also have the PAPR. And PAPR, I'm going to put, just in case you guys aren't familiar with it, APR. So in case you want to look up PAPRs, teach yourself a little bit more about PAPRs, and then in turn make sure you're teaching your students about PAPR. Because if you can't be fitted for N95, it doesn't mean that your responsibility is released, or you don't have to come in contact with these people. You may still be in contact with these people. So they need to understand that PAPR is an option and understand how to use a PAPR. Okay. So I definitely wanted to bring that up, and then I'll give you guys the guidelines, because I feel that you guys should have the guidelines and know the guidelines from the CDC about how to deal with this. So I'm going to place that link in the chat real quick. If for whatever reason a PAPR and neither a PAPR nor an N95 are available, the CD says to use eye protection such as goggles, or that the disposable face shield that not only comes all the way in front of, but all the way around the sides of the face as well instead. Okay, so I'm going to put that in the chat. Are you good, Vicky?
Yes, we just have people that are still struggling to find the link on Facebook. So I'm still dealing with that, but I think I'm ready to move forward here as soon as I send this information here. Okay. All righty. So let's talk about the main topic, clinical alternatives.
Yes.
So again, we talked about that nursing homes, that each state is specific in terms of the amount of clinical hours and where those clinical hours can be completed. And I'm definitely not recommending that we disregard the mandates by our state that say where and how many hours that we have to complete. And no way am I saying disregard that. I'm saying comply with it. But more equally importantly, please stay in contact with your regulating body in your state, whether that be the Department of Health Services or whether that be the Board of Nursing, to keep up with development and changes, because you want to be sure that if they allow something that wasn't permitted before as a result of this pandemic, then you want to be on top of that and be able to move forward, because that can open up a lot of opportunities for you in terms of moving forward with your program. So since students are not likely to be allowed into skilled nursing facilities until an unknown period of time at this point, especially after yesterday's nursing home restrictions, then let's consider some alternatives here. So number one would be hospitals. And this is, again, these are specific recommendations. If you already are going into a hospital and no longer allowed to, that may not apply, but for some it could apply. So hospitals, there might be some restrictions on going into the CNA students going into the hospitals. It is often a lengthy approval process by the hospitals. And this is especially challenging if your CNA program is an accelerated program, because hospitals require an extensive orientation process, compliance, screening, and then there's a lot of logistics involved in having students go into the hospital. So students cannot generally just go into the hospitals as easily as nursing homes. There's a lot more to it. And if students, if the hospital requires compliance be handled by a third-party entity, such as My Clinical Exchange, that can be an additional charge for the student. So just an FYI in there. So I want to pause here for a second and just get any feedback from anybody that if you've heard from hospitals that are also canceling clinicals for the students. If you can put any comments in the chat box there.
Yeah, so Diana, I agree 100%. Diana said, I think that CNA should already be allowed to do clinicals in hospitals, and I agree. This is something Vicky and I have talked a lot about. The OBRA Act of 1987 is very old and needs to be updated, and this is an example of why it needs to be updated. According to the OBRA Act of 1987, students are only allowed, nurse aide training program, are only allowed to do clinicals in long-term care. That needs to change because a lot has changed since then, and students do not only work in long-term care facilities now, they work in a multitude of places. And so when all this dies down, of course, this should really be something that should be on our radar, that we all should be advocating for, okay? And when that does come, we'll be reaching out, and we definitely look forward to you helping us push that forward when that time comes.
And just to give you a little bit of varied perspective, with Victoria being in Georgia and I'm being in Arizona, we're just giving you a little bit different perspective. So in Arizona, the CNA clinical requirements are 40 hours minimum. 20 of those have to be in long-term care, and the other 20 can be in any direct patient contact environment. So just a little bit of perspective. So here in Arizona, we can go to the hospital, but generally the students do not, again, because of the lengthy process involved with compliance, orientation, screening the students, and the slew of requirements from the hospitals. And then also there's an additional charge for all that screening that occurs. And the screening requires the orientation. And it's usually about 4 hours of orientation that students have to go through online. Usually it's a 4-hour orientation. So with an accelerated program and it's a month or 3 weeks, it's just not doable for students. Just not doable.
So Sherry says, in Texas, the state will not allow them to count hospitals as clinical hours. And we know that. And so, because some states won't, but that's the reason for this conversation, Sherry. We need to challenge the nursing boards, and we need to challenge the public health departments. We need to challenge them during this time to look at different options.
Exactly. And Mark,
halting is not a choice. We need to look at other options.
Exactly. And Mark, thank you for your comment. The banner system has stopped clinical for all students. So there we go. We're in it with all other students as well. So thank you, Mark, for those comments. I challenge my state with lawyers. They don't budge. Okay. And then Sherry.
So Jasmine says in Georgia, and I got that email too, Jasmine. In Georgia, they actually are allowing the students to complete out their clinicals in the lab temporarily. And from my understanding, it's only for the current session. So any future sessions, that's up in the air. But if you have students who are currently in class and they need to do their clinical portion, they can do it in the lab for now.
Okay, and thank you, Mark. Also, Mayo has discontinued as well, students. I think we're just going to see it across the board. I think we're just going to see it across the board. So, all right, so let's talk about the next option is, the next option for clinicals is hospice inpatient units. And in no way am I saying that terminal patients are unimportant and we should put them at risk. I am not saying that. My own mother is on hospice, so I would not say that. But I'm simply identifying another option here. And hospice inpatient units, some of them are pretty good size. I mean, most of them are small, but some of them are considerable enough so that if you have small classes or if you break up your classes, it might still work for you. And anybody who thinks that hospice CNA students would not get extensive hands-on practice, think that again, because I'm a hospice nurse and I've worked inpatient before, and it is very, very busy on those hospice inpatient units. So consider that. So that is another option as an alternative clinical site.
And I want to say something about that real quick, Vicki. The state of California already allows that. So if you're in California and you didn't know that, you are already allowed the ability to utilize a hospice facility as a clinical site that is encompassed as a long-term care facility. It is defined as a long-term care facility in the state of California.
Okay, all righty. Thank you, Victoria. The other option also is home health, whether that be home health, traditional home health, or home health with hospice. That is another option as well. And I know some of you are going to say, well, then there's no instructor that's going to directly supervise them. let's think this through here. So if a student is paired up with CNA that's going to go out and see 8 patients throughout, or 7 patients throughout the day, if maybe the clinical instructor will schedule their day so they can meet up with each of their students throughout the day, that might be an option. Maybe they're going to meet with student Susie Q at Mr. Jones' house at 9 o'clock in the morning for 10-15 minutes. And then at 10:30 in the morning, they're going to meet up with their next student at Mr. Jackson's house, or whatever the case might be. So it's totally doable. And again, CNAs that work in the home care, with that home care hospice or home care home health, they get an extensive hands-on experience in there, because they're also using Hoyer lifts. They are doing brushing teeth, personal care, changing briefs. They do as much as they do in the long-term care facilities. So a different patient population, yes, but they get that hands-on care, which is very, very important. So I want to see here if any of you all are using any home health agencies to complete any clinicals.
And I want to add, California is another forward-thinking state, and you are allowed to use home health for clinicals for CNAs, because that is defined as long-term care in the state of California.
Very good.
You guys, this isn't the opportunity to be having these discussions. We need to move legislature forward. We need to ensure that if and when something like this happens again, that we are prepared and we are ready. So I hope you're writing these down, and you're going to move these forward and have discussions with your state about them.
Yes, absolutely. So home health, hospice is an option there. And I gave you some practical recommendations on how a clinical instructor could still supervise the students. And I want to say on a side note that nursing students, particular BSN students, not necessarily ADN students, but BSN students, as part of their community course, they do home health. And that's exactly how the clinical instructors monitor them, is that they just check in with the students that they have assigned with nurses throughout the day at different home care visits. They just schedule to meet up with them throughout the day. So it's totally doable, and they still have 10 students or however many students for the day. So if it's doable for nursing students, why can it not be doable for CNA students? It's just, again, I think OBRA has put considerable restrictions on our clinicals, and some states have been able to push forward beyond that, which I applaud them. So thinking again outside the box. Okay, you're able. So Antoinette says, I'm sorry, I'm just joining in. No worries. She's in California. We're able to use a lab as clinical sites while we're in shutdown right now. Okay. All right.
Which is the reasonable alternative. I think a lot of states are allowing this, just do your hands-on, because I was looking at the law. I was talking to Vicky about this. Technically, the law says that there needs to be at least 16 hours of hands-on experience from a federal standpoint. And that's all. It doesn't really say, it doesn't go into depth. Each state has decided that, maybe we want more or whatever and so forth. So technically that's hands-on experience in the lab, and I think that's why they're allowing this. Now, do I advocate for that at all times? No, but we got to do what we got to do right now.
Exactly. And the other thing also is keep in mind that OBRA states that 16 hours of class time needs to be completed before a student can go out to clinical. So if your training program is structured so that everything, all classroom, all lab has to be done before students go to clinicals, maybe you might want to rethink that and know that 16 hours of classroom has to be done before students can go out to clinicals. And those 16 hours, the content has to cover resident rights, abuse and neglect, and infection control measures. So as long as those 3 topics are covered and you've got the students have 16 hours under the belt, they can go ahead and go to clinical. So maybe on day 3 of your course, if you've covered those in 16 hours, maybe you can and you have an opportunity to take your students to clinicals, take them to clinicals. If a clinical spot opens up, think, hey, we're going to clinical. So I know these adjustments are hard to make on the fly, but these are unusual times. So just having to be flexible is important.
Yeah.
Okay. So the next one is assisted living facilities. Assisted living facilities do a lot of hands-on care, and some of them hire CNAs, some of them do not. but something again to consider is assisted living facilities. And some thoughts on that, Victoria, because I know we discussed that yesterday.
I tell you what, my very first job was in assisted living, and I promise you, over half my patients were real deal nursing home patients. I think that with assisted living, if they have the money, depending on what depending on what the care is needed for that resident, they'll allow them into assisted living. So yeah, I think assisted living is still a really good place for CNAs to learn, and I think it should be considered.
Yes, I agree. Now, here in Arizona, in assisted living, they don't necessarily hire CNAs, although some of them have the designation of caregiver and CNA. But when they're working, they're actually working under their scope of practice of a caregiver. So it would be a little bit of a challenge to pair up a CNA student with a caregiver who's not a CNA. So it's just some challenges there. But again, it's totally doable because they are doing hands-on care. Those assisted living caregivers are doing hands-on care, very similar to what a CNA would do.
Yeah, it's all about, ADLs, personal care, basic nursing skills, and they are doing that in both areas. So.
Okay, very good. So the next one is adult care homes. Here in Arizona, we have adult care homes, and maybe in other parts, I'm sure other parts of the country. And those adult care homes are homes, private homes that people have turned into essentially care centers, and they can house here in Arizona a maximum of 10. And they do some quite a bit of hands-on care. It's totally hands-on care. They have high levels of care of patients there that are quite acute. Some of them are on enteral feedings. They are almost all incontinent, many dementia patients. I mean, patients that give good hands-on experience to CNA students. So any others out there in terms of any other individuals out there in states that do adult care homes aside from Arizona?
Lakeisha said she likes your idea about getting clinicals out of the way earlier and wish that she had already done that. Yeah.
Mm-hmm. Okay. All right. So that's another option. And then other option is private duty agencies. Private duty agencies hire CNAs. And some of them have long assignments for the day. They can sometimes be with the patient up to 8 hours. So I've hired private duty agency for my mother who's on hospice. And the gals that come out, some of them, or individuals, workers that come out, are some of them CNAs, and they help my mom with quite a bit of ADLs. So again, it's that's another option, absolutely another option. I know that we hadn't considered it, but it's something to consider. Private duty agencies that hire CNAs for completing those clinicals.
And I personally think that would give them the ability to really hone in on skills a little bit better, especially in the beginning phases when they're trying to get things down. Mm-hmm. And then later maybe move on to where they have multiple patients that they're caring for, but it allows them to hone in on particular skills one-on-one with someone. That's a good idea.
Yeah, a little slower paced.
Mm-hmm.
Yeah, a little slower paced. Absolutely, absolutely. Okay, so the other one is outpatient surgical centers. They hire CNAs as well. I know that many of us don't consider those, but that's another option as well. Outpatient surgical centers. They do a variety of skills there, and again, maybe not the feeding and whatnot, but I know that they have to do personal care because I've seen it, and they do vital signs there. Critical thinking is very, very much in place there as well. So that's another option, is outpatient surgical centers.
Okay.
And then another one also I thought about is our dialysis centers. Dialysis centers hire CNAs, and they have dialysis techs, and oftentimes dialysis techs have been CNAs. And I have been in dialysis centers where I see the dialysis techs helping out with quite a bit of personal care, So that's another option to consider. And there are a lot of dialysis centers out there, a lot of dialysis centers.
They're popping up everywhere.
Mm-hmm, mm-hmm. And I'm not really sure how many beds a dialysis center would have, but it would be, again, something to consider. And maybe you may not be able to stay with just 2 or 3 students at one dialysis center, but maybe if you have 2 or 3 dialysis centers, you can the instructor can pop in throughout the day to check on the student, just like a home health situation. That might be something to consider as well.
You know, what this sounds like to me is, you know, when we were in nursing school and we have these multitude of different rotations that help us become very well-rounded and knowledgeable individuals, if the CNA's experience were similar to that, which these options would allow that, then it can help them be a little bit more well-rounded as well and help them learn about what their options are when they get out into the workforce.
Exactly. I totally agree. So maybe I'm hoping, as we talked about, Victoria, that this will maybe open our eyes and maybe help us revolutionize CNA and make a change to it for the positive, I see.
Yes, because it's long overdue.
Exactly, absolutely. And OBRA has really has been a huge restriction. It was a plus for many years, but now, even though there's many things that are positive about OBRA, but it's put on some considerable restrictions. Keep in mind that OBRA is a 33-year-old federal law that we are still working under today that is very outdated. So, yeah. Okay. So any other suggestions for clinical sites or thoughts? I'm going to move forward here, but any other thoughts that that you are addressing, that you are considering, that you are thinking about, that you reached out to? Yes, contracts. Yes, Mark, contracts. It's a, I don't know about timely manner. I agree with you. I don't think it's going to happen overnight, but in the meantime, it's something to consider. And then once those contracts is in place, you'll have a broader opportunity or broader area, more areas to take your students to.
Yeah, that's true. But you know, again, you know, I think healthcare has always been knee-jerk. I hate to admit that, but it is. Healthcare has always kind of been knee-jerk. And I think that this situation, hopefully we will prepare for next time. And this time, we can get to where we need a little bit quicker, hopefully.
Okay, so Maria has a comment there. So she's in California and she's a testing center as well. She emailed the California Department of Public Health yesterday, but she hasn't heard from them. She was trying to verify if she can let students continue their 4 days left to plan at school, since we have equipment, medic, and hospital, and so where we can do setting is doable.
That's a doable setting. It's a doable setting, but it's going to be up to them.
Exactly. And again, the regulating bodies, whether it's the Department of Health Services in your state or the boards of nursing in your state, and in the U.S. territories, it's the NCSB and National Council. So we have 3 types of regulating bodies for in the U.S. and U.S. territories. So the National Council of State Boards of Nursing regulates CNA in the Mariana Islands, U.S. territories, and the Virgin Islands. So they are behind trying to catch up and trying to get their head around all this as well. So, and they want to make smart decisions, not just reactive decisions as well. And I can respect that and understand it and appreciate it as well, that they're trying to get their arms around this situation as well and be compliant with federal law, and also make sure that the CDC regs are being respected also. All right, so some course options. So let's talk about that. Some schools are extending spring break in hopes that within the next several weeks, restrictions will ease and the pandemic will be downgraded. So that's some things that are going on with the schools, is that they are, instead of 1 week spring break, they're extending out to 2 weeks of spring break, thinking maybe that extra week might give us some time and something will ease up. So I'm seeing that. Okay. All right. So next option for course is some schools are having students complete the entire course and postponing clinicals until a skilled nursing facility will allow clinicals again, and then, or until the regulating bodies approve alternative clinical sites. So what that means is that some of the schools are deciding to have the students go through in the entire program and then just saying, but the clinicals, we're going to have to put those off for a little bit until I hear something more, or more clinical sites become available or whatnot. If you do that, make sure that you disclose that to the students, make sure that you have that in writing, make sure that if you're accepting new students under that protocol, that the students are fully aware that maybe a signed contract is in place, because the students need to be clearly aware of what's going on in terms of clinicals and how you intend to deal with it.
Right.
Yeah, you don't want to just spring that on them at the last minute. So just a couple of things going on here in Arizona. On Thursday, the Board of Nursing, the Arizona State Board of Nursing, which regulates CNAs, had a conference call and discussed the possibility, and I want to emphasize the possibility of doing lab simulation in lieu of clinical hours. This option would need to go through the Board of Nursing approval process, which would take some time, and this option would have very specific restrictions, such as all clinical venues would need to be exhausted before clinicals could be substituted. I mean, a lab would be substituted for clinicals.
Oh,
so it's something they are considering, but not approving right now. I just want to be very clear on that it's under consideration, and it would take so the Board of Nursing needs to look at all the avenues and impacts of all that and whatnot. So again, it's something they're looking at.
I want to address two things. Yvonne said she's wondering if a doctor's office would be a good setting.
I don't think so. I don't think so. They do very little activities of daily living there.
Yeah, I mean, it would be good for vital signs maybe, but then that's all. I don't know that I would recommend it, and I don't know that they would allow that. Lakeisha, you have a very good point. Lakeisha says she's thinking about adding to her policies and her catalog for students due to the nature or any type of natural disasters or, state of emergencies, which is what's going on now, that they will have to reschedule clinicals and you may not be eligible for a refund. That's an interesting topic, that part, because Lakeisha, I know that you're in Georgia. And so in Georgia, there is no Department of Higher Education that oversees our nurse aide training programs, where in many other states there are. And so if you have a Department of Higher Education, they usually make you implement like a surety bond and having some type of insurance so that if something were to happen and you can't complete the course for the student, they get their money back. And it's not you that's paying it, it's the insurance that's paying it out for you. In the state of Georgia, we don't have that. So that would be a very interesting, how you would place that wording and whether or not the state would even approve something like that, saying you wouldn't be eligible for a refund in the event of something like that happening. Very, very good point, though. That's definitely something that needs to be looked at and to consider to put into your catalog, because who would have known?
Mm-hmm. Yeah, absolutely. Absolutely. All right. And then Laura wants to know if Texas, what's the protocol for Texas there?
Yeah, Texas does have a Department of Higher Education overseas, which is the TWC. And so you guys do have to have you're covered in the event that something were to happen. They make you be covered, rather.
Okay.
Yeah.
Okay. So we talked about the Arizona Board of Nursing again. Stay connected with your regulating body for CNA, because things are changing quickly under development. You want to stay up to date on all that. So, okay. So another option is and we talked about this, to continue with classes and disclose to students that clinicals are postponed or extended for several months as clinical sites become available. And then of course, unless something I don't know, but unless students complete the clinical hours, would that be lab substituted for clinicals or whatever the case might be, you would not be able to give a certificate of completion until the clinical hours are completed. And you wouldn't want to. We want to make sure, even though all this is going on, that the CNA students that we're sending out to the community are safe and they're competent practitioners. That is paramount here. So it's really important. So we would only be able to give a certificate of completion once all the requirements for the course have been met. And so one thing also is if the students are postponed in their course, and then let's say all the classroom is completed and then all the lab is completed, but then the clinicals are not done till a month or two later, and then the clinicals are completed, you give them a certificate of completion, and then they can now test. Keep in mind, this is really important, that keep in mind that it could have been up to 3 months prior to, or quite a bit prior to, that they did labs, that they did skills, that they test, that they need to prepare for testing. So in other words, if the last time they did an occupied bed was 3 months ago, and now they're ready for testing and they haven't practiced that skill for a while, and they go into testing, they could fail. Remember, the sweet spot for passing the certification test is about 7 to 10 days. If they go beyond 10 days and haven't practiced skills that they're going to be tested on the certification test, the potential for failure is very high. And of course, then your school pass rate will be coming down, and then you're going to be dealing with another problem of a very low pass rate for your school. So if your students you postpone the course and they finally get the clinicals in, and then you give them certificate of completion, it's been a while since they practiced skills in the lab, and then they go to test, they're probably not going to be successful. So you want to maybe have some option for having them to come into the lab to practice the skills that they're going to be tested on, so that they're prepared for the certification test.
Yeah. And Diana says, well, you need to have an open lab in order to review, which is true. Now I haven't heard, you guys let me know if you've heard something, but so far I have not heard of any state saying that students cannot come to campus. I haven't heard that so far. So if that were the case, then they would be able to come to the lab to review. But again, we need them to do what they got to do, wash their hands, spray them down. Who saw that video? I don't know if you guys saw that video of those parents spraying their kids with Lysol as they got out of school before they get in the car. I know that's not funny, but it is. But anyway, make sure your students are engaging in proper hygiene, hand hygiene and stuff before they come into your lab. And if they aren't feeling well, then they shouldn't. But yeah, as of right now, I haven't seen anything where students can't come in to your actual campus.
Yes. So Cherise says that they offer a monthly open lab for students to come practice. No one ever came.
Yeah, I know.
Yes, that is an ongoing problem, but that's something to put in your protocol as well. And maybe before issuing that certificate of completion, that might be something in writing you might want to say, or we have open lab on these dates, sign up, and we're expecting you to be here. That may be a requirement of your course. I mean, there's ways to handle that as well. But it's going to show and reflect if they don't come into practice and they just go to test and they haven't been to class and lab for quite some time. It's going to reflect on your pass rate.
Yvonne wanted to know what we thought about adult daycare. I want you to know, Yvonne, we're not ignoring your question. What do we think about adult daycare as an alternative option? I don't have a lot of familiarity with adult daycare. I don't know about that one.
I would be open to it. I would be open to it because they do quite a bit of ADLs in adult daycare. They do care for incontinent individuals. Many of them are unable to care for themselves. That's why they're in adult daycare. They do personal hygiene, not necessarily showers, but maybe clean the individual up, and also probably peri-care as well. They do quite a bit of feeding and assisting with meals. That would be okay. Transferring, probably. Assisting with ambulation. So I would be open to that.
Okay. Mark, don't laugh at me. You know what I mean. It's funny, but it ain't funny. All right. All right. So where are we at? Okay, so Connie said Santa Cruz County Department of Education will not allow, I guess you were saying they are not allowing students to actually come to campus. Got you.
Okay.
And as a whole, universal nursing, clinical. One state can do certain things for clinicals that others can't. I think that's the biggest issue. I agree. There's a federal law, but that's like with any law. It's a federal law, and then they allow each state to implement that law as they choose. And so CNA isn't any different, but you're right. I mean, every state is so different on so many levels. And so it makes this even more complex. So.
Absolutely. Absolutely. Unlike the NCLEX or unlike nursing, they have a little more, I think they're a little more streamlined than CNA.
Now I want to know who here, we're going to talk about this in a minute, but who here has a blended learning CNA course or online CNA course? I guess regardless, it's considered blended learning, but who has that option? Because I'm going to talk about that in a minute. I know, I think, Vicky, you had a few more points maybe.
That's okay. We can pause here.
No, you can go ahead. I wanted to see before I started getting on that topic.
Okay. All right. So as far as, and then the other thing that is happening also with some schools, they are canceling classes altogether.
I don't know that that's the best. I don't know that that's the best option.
Yes. Yes. I would ask that be reconsidered, because a lot can still be done without canceling classes, without canceling your enrollment. And if you are a private school, that can have a devastating impact on your business. It can cause you to just fold. And I would not recommend that. I really wouldn't recommend that. Victoria and I can help you strategize and whatnot, off topic here, or not off topic, but off this webinar. But I would really recommend that you reconsider just canceling classes altogether, because so much more can be done. And this is going to pass. We're going to talk about that later, but this is going to pass. This is not going to last forever. I mean, it's just not going to. So and we don't want your business and your financial life to be destroyed as a result of this. Yep. So reconsider. If you're just canceling classes, reconsider. There are other options. Please reconsider that.
Yes, there are. How many of you have online like you have options for online engagement through your website for those looking to come into your school? Who has that option? Do you know what I mean? Like they can go and self-register on your website, right? They don't have to come into your facility. Who has that option on their website? If you don't have the option, this is the moment to consider that, right?
Exactly. Yes, if you have the type of school or website where you're not set up for students to register online, that everybody has to come in, you have a lot of foot traffic coming, you need your foot traffic in your school, this might be an opportunity for you to revamp that. To have the students register online, to submit their TB skin test, their CPR online. So a lot can happen online without the students having to come into class until the first day of class, and giving you time, or the officials time, for all this to calm down. So in the meantime, you're still taking enrollment and still moving forward with hopefully generating some revenue. Okay, so Mark, the school has postponed classes for a week. That's understandable. Okay, for students only. Don't show for class per. Okay, so what should you do if students don't show for class per handbook policy? Whatever your policy says, that's what you would do. How would you handle it normally?
Or if you feel like maybe your policy is not considering this type of situation, then maybe you need to do something to change that policy. So I guess what I think you're saying, Diana, is if you're saying they still should come, but they're not, I mean, in this situation, I'm not going to hold a student, accountable. Hey, you should have been here when the whole city's shut down. Then, I'm not mad at them for that. So I think that, again, what Lakeisha said earlier, implementing some type of state of emergency policy, or making sure that that's in your policy, is something to consider. And even for me, that's something for me to make sure that I'm considering with clients that I work with moving forward, because that is important. Who would have known we would be here right now?
Right. And Tatisha Marie made a really good point. She said, if schools and universities around me are closing, it seems like you should too. Rethink that. Every situation has an opportunity. So if the community colleges and universities are closing and you have a private school and you stay open, you're receiving enrollment, that could be an opportunity for you.
Guess what people are doing right now? Right now, people are home bored. Look at people. First of all, everyone's online right now because no one's going anywhere. Everyone is online right now. So you want to be available when they call you, because everyone knows that this is going to pass. So they're wondering, what are they going to do next? So if you have a private school, or if you have a school period, like, you want to be available. Forward your phone calls. If you're not going to be in office, forward your phone calls to your cell phone. Still continue to take enrollment and just let them know, hey, maybe this class is going to be pushed back. This is the potential day we're pushing it back to, but I'd love to have you then. You do not want to shut down all operations. You don't.
And again, we want to go back to, once this is all done, or if the pandemic gets worse, they're going to need those CNA students. They're going to need more CNAs. So we have to keep the pipeline going, even though maybe it'll go down to a trickle, but we have to keep the pipeline going and keep moving forward with this. We are healthcare providers, and we cannot stop doing what we do because we are at the forefront of and in the trenches of this. And we knew that as healthcare providers, so we just need to move forward. Obstacles are gonna be in our way all our lives and throughout all our careers, and we have overcome them up to this point, and we will do that as well in this situation. Let's see. Can we offer classes via Zoom? Well, Laura, that is something per your regulating body, if that allows, or is it in your curriculum, or how does that? What does your regulating body allow in regards to that?
And that goes back to what I was asking about blended learning. Those of you who have blended learning already and you're approved, because in some states you can have, first of all, there's like 20 something states where you can have blended learning, but it has to be approved. So if you're not already a blended learning approved facility, you may not be able to do that. But now's the time to think about that. So I would be asking all of you to find out whether or not you're in a state where blended learning is an option. If blended learning is an option, then you need to highly consider implementing and getting approved for a blended learning course, because number one, that's just where education is going.
Yes. Yes, and for in Arizona, there is a stipulation in the regulations that online CNA is an option, but the Board of Nursing wants you to submit a curriculum proposal for that. So there you go. This could open up the floodgates for that. So that is an option there. Mm-hmm. The state of emergency policy, Mark is talking about policy. Yes, I love that. Absolutely. So there's in your handbook or your policies and procedures, state of emergency policy. Put one in there.
Well, after you leave here, you all should be implementing one.
Exactly. Okay, so let's see. That's what I'm talking about. Universal. Some states can do that and some others can't. Okay, so I'm not really clear, Antoinette, what she's referring to. That's what I'm talking about. Universal.
Oh, because she was saying that all states need to get on board on the same accord. Yeah, Tatisha says, so she was referencing not calls, but actual class, whether or not class should, if everyone else has classes stopped, shouldn't you? And again, I really think you should reconsider that and just figure out what works best for you. I think for you, Tatisha, I think you have blended learning. So this is your opportunity to expound upon your blended learning. I would continue to have blended learning courses, period. I would continue to have them. And then if you're not feeling comfortable with them coming into your lab, then don't. If you do feel comfortable having them come into lab, then do. It's something that you as a business owner would have to make a decision on, and then not only make that decision, but find out whether or not your class feels comfortable with that decision as well. But for those of you who have blended learning, you need to expound upon that. And if you don't have blended learning, really, really consider that.
Yes, totally agree with that. So if you're going to keep your class open, just some environmental strategies here, and the CDC recommends this as well. So if you're going to increase your online presence, we talked about that. So on my bullet here says, if you're going to keep your doors open, make public your compliance with CDC protocols with regards to disinfecting and environmental management. So you want to, the school that I work with here, that I teach with here in Arizona, they are implementing extra housekeeping policies, disinfecting, cleaning. They're putting more signs in and outside the school of how they are planning to comply with CDC protocols. And then they are also increasing their online presence as well. So it used to be only registration in person. They are moving forward with registration and trying to do as much as possible online. And then for those that are, I've been contacted recently, the last several days, about the Facets training program, CNA training program, as an additional online resource. So that's an option for you all as well. So that's another opportunity.
Yeah, and that's good for your students. Like while your students are out and they're not actually in lab, they could be utilizing those videos to learn and even practice at home. Get their child in the bed and practice doing things on their child. I mean, how many of you remember in school, in nursing school, going home and practicing things on people you live with? It's the exact same thing. So those videos would help walk them through that. There's a company, if you guys go to my website, there's actually on my website a new company called Cinematic Health, and Cinematic Health offers blended learning courses for classroom. So like Tatisha said, if you are not comfortable with your students actually coming to the classroom, then they could utilize this blended learning platform online and take those courses online at home for the classroom. So that's an option too. If you're not already implementing something like that, think about it.
Yes, absolutely, absolutely. Like I said, this could open up so many more opportunities for you all. So, and again, every situation opens up an opportunity. So it's not always doom and gloom. There's an opportunity in every situation. So, okay, so moving on here, Victoria, I think you already talked about proper protection techniques. I think you covered that while I was addressing the. Okay. Okay, and then did you want to talk about postmortem care also for the coronavirus, or we're good there?
Yeah, definitely. So this is also a part you may want to think about implementing into your curriculum is postmortem care. Now on the CDC's website, you know, we already talk about postmortem care, but there may be a question on how do I care for the body after they've died from COVID-19 or, you know, something similar to that. So the CDC has regulations on that, how you would actually care for that type of patient. And to be honest, the CDC regulations state that there's not much different you would do that you would already do with any other person for postmortem care, as long as there's not any type of aerosol body debris or aerosol body secretions. So for instance, now with autopsy, that's a whole other situation. With autopsy, there would be different things that could cause aerosol debris. So, but for just the regular person who's doing postmortem care, the CDC recommends utilizing standard precautions. So I'm going to put a link to the CDC's regulations for postmortem care for this type of person as well. I thought that was really great information to know, because you never know unless you're the CNA caring for a person who has passed away of COVID-19 on how to deal with that, right?
Absolutely.
So I'll put that there. Now, one of the things I want to do before we go, again, if everyone can please like and share this video, because I know this is information other people want to know and want to hear or may have questions about. So you're going to help get that information out there. But before we go, we really want to talk about how to keep calm during all this, right? How to keep your mind at ease. And one of the things I'm going to point out that I don't know if a lot of you thought about, but I've done my research. I wanted to make sure I was correct about the very last pandemic that occurred in the end. And that was back in 2008 and 2009. And that was the H1N1. That was the very last pandemic that we've seen. And you guys, globally, it caused 100,000, anywhere from about 100,000 to 400,000 deaths the first year that it hit, within that year. So that's a lot if you really stop and think about it. And for H1N1, influenza A, H1N1, we survived. We're still here. We still have CNA classes. We still have people entering the profession. So for those of you that are fearful, because I've gotten a few phone calls about this, you know, should I still have a CNA school? Should I go into this? Is this something I should halt? No, this is something that's just going on for the moment. So yes, you might have a dry month. That's business. You have to prepare for those times. But people are still, they're going to forget this happened, just like you forgot about H1N1 until I just mentioned it. People are going to forget that this happened, and they're going to continue to live their lives. They're going to continue to want to get into the healthcare field. They're going to want to become CNAs and nurses and whatever else. So your school will continue to be viable. So please don't be fearful. You know, is this the right decision? Should I change directions or whatever? This is just something for the moment. Now, again, we have to think about things that we can implement so that if and when the moment happens again, how we can be prepared for them. And I hope that this webinar so far has empowered you with those options, right? I really hope that that's what we've done.
So to summarize, Victoria, one of the things that was a takeaway from this was being able to open up our eyes to other clinical sites that clinical opportunities that we hadn't considered before. Long-term care and hospital, we can think outside of that and make more have more varied clinical experience. So we, as you say, we can become more, what was the word that you used? I'm trying to think about it. So we can become, well, whatever it is, but we can be able to care for more patients in different settings is what my point is. Yes, my point is. And then the other thing also is, don't stop your classes. Consider more of an online presence, and then stay in touch with your regulating body, whether that be the Department of Health Services, the Board of Nursing, the National Council of State Boards of Nursing, to see developments, and then contact them for and push for alternatives.
Give them ideas. They're not thinking of, give them ideas. They probably have so much going on right now. They didn't even think about half of the things we just spoke on.
Yeah, and this could be an opportunity for change, good change. I think good change. And then for those of you that are still in the process of opening up your CNA school, you might be able to find some bargains out there.
Oh yeah.
Yeah, you might be able to find some bargains out there in terms of.
This is a time to look over your business, get organized, and continue to strategize for other revenue methods. And that is so true. Like, now is the time to invest. If ever before, this is the time to invest in whatever it is you choose to invest in. And if that's your business, then now is the time to do that, because like Vicky just said, people are scared. I hate to, people are scared and they're doing whatever. Maybe they're selling stuff, they're getting rid of stuff because they want to hoard money, just like they want to hoard that toilet paper. I don't know. But now is the time to capitalize on that to a certain extent when it comes to your business. So look for those great deals. Look for, like you said, look at your business plan, re-strategize how you're going to implement other programs in the future. How your current program is running. Is there something you should alter based upon what we've discussed here today or what other people have brought up? Like, this is the time for that.
Right. Absolutely. And this will pass, and just move forward. If this is a good time to revise curriculum as well, if you don't have much of an online presence in your curriculum, maybe this is the time to implement that and recognize that we're in the era that should be. I think it should be. It's totally doable. It's totally doable for a greater online presence for CNA. Yeah.
So any other questions or anything else anybody wants to add? I see that Vicky said she's in Texas. Victoria Davis said that her current class is allowed to finish up their clinical hours, and luckily they only have 3 days left. So that's awesome. Yeah, Georgia is so behind, Lakeisha. I don't know if Georgia is going to be, we've got to, hopefully this will allow Georgia to push to be open for hybrid courses. Hybrid courses have not been an option for nurse aide training in Georgia so far. So hopefully this will help push for that. Yeah. But yeah, I hope that this was really helpful for you guys. Thank you so much for joining us. Anything you want to add, Vicky?
No, I was just really glad that we were able to do this together, because I was getting a lot of calls coming in and asking about the clinical sites, and that's how we're going to move the students forward and whatnot. And so I appreciate that we were able to do this together, and everybody that joined us, and recognize that we're all in it. It's happening nationwide, so we are all in it. And we're gonna hang in there. We're gonna get it. We're gonna move through this, and we're gonna get past it. And we're gonna be have stronger programs as a result of it. We're definitely gonna have stronger programs as a result of it. So I wanted to also add that because I've been getting calls from regarding my online program, my CNA test prep. I wanted to do something to help out and make it more affordable to any program that might want to purchase it. So I'm discounting all my products 30% off, and for anybody who chooses to redeem within the next until Thursday. And so I have a discount code. I want to put it in the box, and I'm having trouble finding the box.
I'll do it for you.
Okay, so it's Corona 2020.
Okay.
And it's all lowercase.
Okay. So if you don't already have some type of online skills video option for your students to practice on, this would be a good opportunity to implement that. So I went on ahead, and I also put a link to her website too, in case you guys are not familiar with the website and you want to get to that website. Let me put the website in the chat for you also.
And I've also had been contacted regarding affordability. Vicki, I can't afford it. I really want the product, but I can't afford it. And we're willing to work with you. We're willing to work with you in regards to payment, because we want to make sure that this is available. And if you, we don't want pricing to be an obstacle to obtaining the product. So we want to be able to help.
Personally, I don't think it's expensive.
Yeah. So no, if we need to work with you with a payment option, we're willing to work with you with a payment option. So just contact us, and we remove hurdles to make it happen for you, because I so believe that the product has been really helpful to the students to help move them forward and make more CNAs available in the workforce, and to help them pass the first time. Because it pains my heart is when I see students taking the certification test over and over and over again, and they don't pass, and they are well-prepared students, well-trained students. They just don't understand how to pass the certification test. So go to my website so that you know what states I'm in. I'm in 20 states, including the District of Columbia, and 3 US territories. So you can check my website to see where I'm located. And Victoria and I are available to help you with strategizing with your business, how to help you through this, what you can do, and anything else that we can do to help you. We are here to assist you. And don't give up. This will pass. Don't give up. Don't give up. This will pass, and we're going to get through it all together. So I hope that we can do this again, Victoria, because I think it's been really helpful, encouraging as well. Lots of good ideas. So I'm hoping that we can do this again soon.
Yeah, no problem. We're always here for you guys. Me and Vicki reached out, to each other almost at the exact same time. Like, we've got to address this. We've got to give people an idea, give them some options, and really be there for them in this time. So I'm glad that you guys decided to join us. Deja has a question. She says, if she does get the product now, does she have to use it now? Because she really would like to invest in that.
No, she can redeem at any time. So yeah, if she purchases, she doesn't have to use it right away. So
okay, all right. Also, I wanted to say, for people who are having strategy, issues, maybe you want to help strategize in your business. Maybe you have a CNA school, but you need to know which direction to go. You're having some questions there, or maybe you're still in the process of getting started. Like I said, now is the time to take a moment to educate yourself on that. So I am doing free 15-minute strategy session or getting started phone calls all week. So from Monday through Friday. So feel free to utilize the link that I placed in the chat. If you want to book a free 15-minute session with me, I would love to talk with you and answer any questions that you have. If you want more time or feel like you need more time, there are other options on that page as well. But if you want the free 15-minute, I'm happy to talk. Connie, I haven't yet. I have not, but I am in the process of it. I've been in the process for a minute. I need to get fire underneath my butt. But you just gave me more fire. I have not, but I'm getting there.
Does that mean that you just need to sleep 3 hours instead of 4? Do you get 4 hours of sleep? I didn't think that you got 4 hours.
Last night for once I got more than that, but no, all this week I have not.
Okay, and then the other question that I get also is, Vicki, how do I implement your product into my curriculum? I'm not really clear how to implement your product into my curriculum. I will be happy to go over that with you, as well as I need to put up some videos on some direction for that. So that's on my agenda to-do list as well. So, and I'm constantly putting more and more product out there on my website. One of the things that I have planned before the end of the summer, before the end of 2020, is to have lesson plans and a PowerPoint lesson plans for different subject areas for CNA, and then corresponding quizzes. So I'm hoping to roll that out by the end of the summer. So I think we'll add even more value to my product as well. So just trying to think of all the different things that are needed for CNAs, and that would be helpful to the training programs as well. So Candace, I will place it here later. Okay, I'm going to read through in there. Yes, I will plan your YouTube. Okay, all right. So we're looking forward to your book, Victoria.
I see that. Thank you, Connie. I appreciate that.
Okay.
I appreciate that. Well, you guys, again, thank you so much for joining us. I'm sure we will both be placing a blog article out here soon, just giving a brief synopsis on this. Also as well, this will be going on YouTube, both of our YouTube channels. So if you missed it, you can always come back and catch the replay, or you can also visit our YouTube channels as well to watch more. So I'll make sure that I put the link here for that also. Okay, guys?
Okay. Thank you so much for joining us, everybody. We hope this has been helpful, and send us an email or contact us if you have any additional questions.
Yep. Talk to you guys later.
Thank you.